Hello, good morning. It's me, Tito. Today, I would like to give you explanations on the lectures on circulatory disturbance. So, as you know, that the blood circulations actually regulated by heart, and heart pump the blood through vascular systems. They are arterial, venular, capillary, and also lymphatic vessels. As you familiar that blood consists of a fluid, it means plasma, and also solid parts, it means the blood cells like erythrocytes, leukocytes, thrombocytes, and others. In general, there are three compartments of body fluids. First is inside the blood vessels, intravasculars, then outside of the blood vessels. Outside of the blood vessels, uh, it means the fluid is referred to intracellular fluid. It means inside the cells, in the cytoplasms, we call it cytosol. And then around the cells or between the cells, we call it the extracellular fluid, or we can call it interstitial fluid. Okay, these are three types of fluid that is exchanged, that is regulated, that is also has a exchange between all of these compartments. And the fluid exchange involve the process of supply on nutrients and oxygens, and also they are also regulate to take up the metabolic waste such as carbon dioxides. Okay, I think you already know about this scheme of blood circulations. This is a closed circuit of blood circulation. It means if it's a closed circuit, there are two kinds of vessels. There are two kinds of main vessels. There are veins and arteria, and then the circulations are regulated by a main pump that we call as heart. As you know that blood from all part of bodies will flow from the organs to the right side of the heart. Okay, it means the right atrium and also right ventricles, and then from the right side of heart, the blood will be pumped into lung, and in the lung there will be exchange between oxygens and carbon dioxides, and then the blood that rich in oxygens will be flow back from the lung to the heart, and then this rich oxygen's blood will be circulated to whole body, will be circulated systemically. Okay, that's a closed circuit. There are also open circuit of blood circulations, but we can only find that in the case of fish. Okay, in the case of fish, yes, there are open circuit circulations, but for today's lectures, we are mainly will discuss about closed circulations. Okay, and then if we look deeper in the tissue, there are also very small network of blood vessels. We call it microcirculations. So this microcirculations is important for supporting cellular life, because in this microcirculations, actually the main process of fluid exchange happens in here. In this microcirculations, branches of artery, very small branches of artery, uh, we call it as capillaries, has a complicated network with a small branches also of veins. We call it venules. Okay. Between the capillaries and also venules, they have a sort of anastomosis. Anastomosis, they have a direct contact. We call it anastomosis. So blood from artery that rich in nutrients and oxygens will be the contents will be transported into the extracellular area, and then the cellular waste and also a carbon dioxide will be absorbed by venules, and then those waste product and carbon dioxides will be taken by the veins to the heart through the vena cava. Okay. And these kinds of anastomosis is very important for balancing the contents of fluid in the tissue, okay, in the body. So among this anastomosis between capillaries and veins, there are also these green vessels here. Okay, this vessel is lymphatic vessels. So what is the function of lymphatic vessels for the fluid exchange then? So about 90 or 95% of fluids in the extracellular area, the circulations, the exchange regulated by the anastomosis between capillaries and venules. However, a small portion, maybe around 5 to 10%, small portion of fluid, about 5 to 10%, are actually absorbed by the lymphatic capillaries. Therefore, lymphatic capillaries, their main functions is to lymphatic capillaries or lymphatic vessels, their main function is to drain or absorb remaining fluids. So they are also facilitate to make balance on the fluid volumes in the tissue. It means they regulate also fluid homeostasis. So what we are going to discuss about circulatory disturbance is all of these 9 subjects. First, hyperemia, congestions, hemorrhage, ischemia, infarctions, embolism, edema, and shock. So we are mainly will discuss all 9 of this in our lectures for these 2 weeks. So first about hyperemia. So hyperemia means it's just a overcapacity of blood within arteries or capillary systems. So it means hyperemia related with blood volumes in the artery or its branches. Okay, and then the causes of hyperemia can be some involvement of vasoactive mediators that makes a blood vessels dilatations, or maybe also because artery also regulated by the vasomotor reflex, some stimuli from the autonomous nerve can also cause hyperemia. So if it occurs in the arteria, we call it as active hyperemia. Why it's active? Because it's involves a pumping activities from the heart, and also it involves pumping activity of the heart. There are pressures that move the fluids from blood vessels move out to the interstitial area. Okay, it means active. There are involvement of other things, okay, to move out the fluids. Generally, the blood in hyperemia is rich in oxygen, except in pulmonary artery, because in pulmonary artery, actually, they flow the blood into the lung and from the heart into the lung, and it contains a lot of carbon dioxides. And if there is hyperemia, the tissue appears also red, bright red, okay, and also a bit warm because there is active process, and also there is also involvement of pressors, okay, to press out and then move out the fluid to the interstitial area. There are two types of hyperemia. First is physiological hyperemia and pathological hyperemia. Physiological hyperemia, we can find it in the ears or face blushing. For examples, if you feel shy or you feel angry, or also a hyperemia, reddening of the mucous membranes in the stomach during active digestions. That's so normal. And also you can find hyperemia, for examples, in the mammary arteries during lactations in cow. During active lactations, you can find the mammary blood vessels will be enlarged. It also refers to physiological hyperemia. How about pathological hyperemia? Pathological hyperemia means there is pathological conditions, there is lesion involvement that initiate the hyperemia process. One of the most common examples is here, inflammations. Okay, inflammations, you will get lectures about inflammations later in the next subject by other lecturers. However, inflammation is important also for circulations, okay, because inflammations makes the supply and also transports of leukocytes can be happen during regenerations or fighting infectious agents. This is a hyperemia in the sclera of eye. You can see here there are dilated blood vessels like this, right? This blood vessels dilated. This hyperemia actually initiated also by a process of inflammations in the conjunctiva. Okay, it called the conjunctivitis. This is all regulated by the vasoactive mediators that initiate the hyperemia process, that initiate also the movement of blood from intravascular to extravascular area. Right, this one also hyperemia in a gingivitis. It's a inflamed gingiva. Inflamed gingiva here. Okay. And then you can see here this is dilated blood vessels during inflammations in the meningen, or we can call it meningitis. Okay, this is formations of suppurative exudate. In Bahasa Indonesia, we call it a nanah. There are formations of pus or nanah, and this also can initiate the pathological hyperemia. Next is about congestions. Congestions is also over volume of blood, but the blood is not located in artery. If we talk about congestions, the over volumes of blood is located in the veins. This is also a passive process. Why? Because the blood flow, okay, is not regulated by the pumping activities of heart. The blood flow is actually happen because there is a differences in the pressures intravasculars, and it's much slower than the uh, transport process of blood by the heart in the artery. Okay, we call it passive hyperemia because it will move voluntarily into the heart. And in congestions, usually the blood is carbon dioxide abundant, except if the congestions occurs in the pulmonary vein. In pulmonary vein, the blood is actually rich in oxygens because the pulmonary vein connect circulations between lung to the heart. The affected tissue, just like hyperemia, in case of congestions, will be swollen, but because there are a lot of contents, because there is abundant carbon dioxides, the colors will be darker and also colder. Why? Because there is no active pressures that regulates the movements. Okay, there is no heat produced in the process. For example, in the case of increased intravenular pressures due to obstructions, for examples, okay, uh, and also if there is increase in the extracellular area pressures, for example, there are excess volumes of in normal condition, if there is excess volumes on extracellular fluid, it also means that the transport mechanisms of fluid from the extracellular area to the veins is not working well. It means that the balance is not happen. There is no homeostasis. Therefore, the fluid will be accumulated in the uh, extracellular area. We will talk about this later. So, what is the consequences of congested tissue? First, if there is congestions, and because also the blood is rich in carbon dioxides, usually congested tissue will lead to hypoxia of the cells, and hypoxia of the cells will cause cell degenerations, then continue to cell death or necrosis, and even atrophy of the cells. In some chronic cases, the chronic congestions also initiate the fibrosis process. Fibrosis means formations of cicatrix, formations of scarce tissue. Okay, why hypoxia happen? Because during congestions, there are slow blood flow into the heart. It makes the heart it makes the blood transportations to the heart is not working well. Therefore, the amount of blood that reach the lung is lower than usual. It's not optimum, the blood volumes. Therefore, there are not so much oxygens that can be circulated from the heart. Okay. And then the congestions, because congestions cause also a increased pressures, we call it hydrostatic pressures inside the blood vessels. It means that more volumes of fluid or more volumes of blood inside the blood vessels, it will cause increment in the pressures. We call it hydrostatic pressures. More blood, hydrostatic pressures will be increased. Okay, and then different on the this hydrostatic pressures makes the fluid will be flow back into the extracellular area, or the fluid from the extracellular area cannot move to the veins. That happens. That's the main mechanisms that mediates uh, fluid accumulations in the tissue if there is congestions. Okay, and then massive accumulations of fluid in the tissue in the extracellular area, we call it edema. Okay, edema. In short words, edema is accumulations of fluid in tissue, in particular in extracellular area. And then congested tissue, if the blood vessels overdilated, it will break off and then cause hemorrhages, or even we call it vascular ruptures. And then if there is hemorrhages, the red blood cells will be ingested by the local macrophages, and then the macrophages will produce hemosiderins. Okay, we will talk much about this later. And then the cause of congestion, it can be a pressures from tumors, over tight ligations, for example, ligations to treat wounds, or over compressions of bandage. The systemic cause of congestions, this one here, this is very common. We call it a congestive heart failures. Okay, here this is the schematic pictures on a microcirculations. This is the normal one, arterioles, branch and its branch capillaries, anastomosis here. For example, 100% of fluids flow into the tissue, and then about 90 or 95% will be absorbed by veins, and the remaining 5% by the lymphatic systems. Okay, that's in the normal process. In the hyperemia, here there are increased flow in the artery. Okay, because there are too much blood in the artery. So if there is hyperemia, there are more fluid will be transported to the extracellular area. Okay, how about congestions? So congestions occurs here in the veins. Okay, so in this vein, they will absorb a extracellular fluid. However, if there is congestions and there is increment of pressures inside the veins, the fluid in the extracellular area cannot easily move to the veins compartment. What will be happen? The fluid will be accumulated. The fluid accumulates here in the interstitial, accumulates in the tissue. So one of the systemic, just like I mentioned, one of the systemic cause of congestions is congestive heart failures. Congestive heart failures can be happen in left side, it means in the left ventricles, or in the right side of the heart, or it can be happen in both sides. Okay, left heart failures will make pressures in the pulmonary veins. It makes a lung congestions. If it's a right heart failures, it makes the systemic circulations that flows through the vena cava cannot enter the heart. So it means there are pressures in the vena cava or systemic venous systems. It means that bloods in the organs will be remains, okay, such as in liver, spleen, or kidney. So the blood in these organs cannot flow completely to the heart, and then there will be retaining of cellular fluid in these organs. Okay, it will cause also what we call as edema. So let's talk about pulmonary congestions now. Pulmonary congestions occurs due to disturbance in the blood flow in the left ventricles of heart. And it also characterized by increased pulmonary veins pressures. Okay, these dilated veins will make also increased hydrostatic pressures that may prevent the movements of blood from lung to the heart. So retained fluid in the lung cause congestions in the lung. We call it pulmonary congestions. And then this congestions leads to increased intravascular pressures. It causes dilated vessels. Some vessels that are overdilated will be ruptures and then causing hemorrhages. And then the increased hydrostatic pressures will prevent fluid movements from the tissue into the veins. It makes accumulations of fluid in tissue that we call edema. Okay, fluid of edema we call it transudate. Edematous fluid we call it transudate. Okay, you will also know about other terminology, exudates, but exudates is related with inflammations. Inflammatory fluid we call it exudates, but in edema we call it transudate because no active process like inflammations involved here. The gross morphology of pulmonary congestions is the lung will be heavier than normals. Firmness, it means increased consistency. And then also the crepitations cannot be filled enough. I mean the crepitations will be minimum. You know crepitation? Crepitation means if you make certain pressures in the lung by your hands, you will hear sort of a creaking or there are creaking because there is movement between lung tissue and airs inside the lungs. Okay, that we call as crepitations. And then in pulmonary congestions, the fluid, it means the edematous fluid will be also mixed with air, makes sort of a frothy fluid appearance. And also because there is dilatations of veins, and veins the blood colors is darker than normal, so there will be dark discolorations. And this is one of the most special event that will occur is there is a brown indurations of lungs. So the lungs hard, the lung will be firm, but has brown discolorations that we call as brown indurations. Okay, because in brown induration there is increase of hemosiderin pigmented macrophages. These macrophages actually a kind of macrophage that ingesting or eating the hemoglobin from the hemolyzed red blood cells. Okay, usually this is occurs in the long-lasting or prolonged congestions in heart failures. We will see many of the cells in the heart. Okay, we will talk about this later. And then also, of course, pulmonary congestions makes the gas exchange between oxygen and carbon dioxide not working well, and therefore oxygen supply to blood systemically cannot occur. Okay, this is pulmonary congestions. You can see here the lungs is darker than normals. Usually lung colors is pink, bright pink, right? But this is darker because it contains a lot of blood inside the veins. And then these congestions will make the fluid retain in the tissue, in the extracellular area, and even large volumes of the fluid the edematous fluid will also flow into the alveoli. And even if the edematous fluid quite much, the fluid will be mixed with air and then makes a frothy fluid appearance, bubbles like this, that we can also find in the large channel, in the uh, large tracts of respiratory. For examples, we can find in trachea or bronchus. Okay, this edematous fluid, frothy edematous fluid like this, makes or block air movements, so it will cause asphyxia in the end. That can occur in here. So the microscopy of pulmonary congestions, if it's occur chronically, there will be a thickening of the alveolar septums with also formations of cicatrix, formations of scar tissue, or we call it fibrosis. There will be also ruptured blood vessels, hemorrhages, and also edema, and this edematous fluid or transudate can also move to the alveoli and make the alveoli dilated. Okay, and then if there is hemorrhages, the lysis of the red blood cells will make a free pigments. The hemoglobins will be ingested by macrophages, and then macrophages, if they ingest the hemoglobins, they will form what a pigment, brown pigment, we call it as hemosiderins. A lot of this hemosiderin in lung tissue, it will cause the lung colors in the end will be has a brownish appearance, and then because it's chronic, there will be also fibrosis. It will also follow by an increased firmness on lung. We call it indurations. This event, we call it a brown indurations of lungs. Okay. So this is the histopathological appearance of congestions. You can see here the interstitial area of lung occupied, okay, in particular blood vessels, completely filled with erythrocytes here. The red one here, this is erythrocytes. Okay, this one is erythrocytes, completely filled the blood vessels, and then increased volumes on these blood vessels also parallel with the increment on the hydrostatic pressures. Difference on pressures will makes the fluid move out into the alveoli. Okay, like here you can see this is the actually this eosinophilic materials refers to protein containing fluids. Okay, that actually this come from the plasma fluid. So if there is much of this fluid, some of this fluid also will be found in the large respiratory tracts. For examples like bronchi, bronchus, or trachea. Okay, this is edematous fluid here. We call this lesion as alveolar edema because the fluid accumulations occurs inside the alveolus. Okay, alveolar edema. Okay. Okay, this is more close view of a congestions. Here we can see in the capillaries, small capillaries, fully occupied by erythrocytes. Okay, and then some of the erythrocytes or red blood cells that escape into the alveoli or in the interstitial part will be ingested by these macrophages. These macrophages, if they ingest erythrocytes, they also ingest the hemoglobins. So this if they ingest the hemoglobin, they will produce what we call as hemosiderins. This hemosiderin contains macrophages. Here we call this one as hemosiderophages or hemosiderin laden macrophages. Okay, and in case of congestive heart failures, this kind of cells will be found commonly in the lung. So if there are so many of the cells, it refers to some failures in the functions of heart, in particular left ventricles or left side heart failures. Okay, therefore if there are many of the cells in the lung, it will represent a heart failure conditions. Therefore, the cells also can be called as heart failure cells or HFC. Okay, this is heart failure cells, or we call it hemosiderin-laden macrophages. It can be in the interstitial part, and also it can be within the alveoli. Here, heart failure cells, okay, found in the alveoli, admixed with edematous fluid. If there are many of the cells in the lung, it reflected heart failures. So how about the next lesions, liver congestions? In liver congestions, the process is almost the same. It's just because there is a blood flow disturbance in the right side of heart. Okay, so the vena cava that involved in the flows of blood into the heart, okay, there is troubles in that vena cava. So there will be a systemic congestions. Therefore, some of the blood in the organs cannot flow well. One of the organ is liver. Okay, if there is a disturbance here in right ventricles, there will be retains of blood inside the vena cava. It will make blood from the liver cannot enter circulations, and it will be blocked. It will be congested in the liver. So the macroscopy or the gross lesions of liver congestions, the characteristic of the gross lesions can be like this. The liver will be swollen and then firm, okay, and then there is also dark red discolorations, just like we found in the lung. And then if we cut the liver, there will be blood accumulations in the cut surface. And the special things that can be happen here, if it occurs in long term, there will be nutmeg liver. What is nutmeg liver? I will tell you on the next slide. Okay, so actually the pathogenesis of liver congestion just similar with pulmonary congestions. Okay, dilated vessels, and then these dilated vessels will make pressures to the surrounding cells, and the surrounding cells will become atrophy. Chronic pressures will cause also degenerations in the cells, and that can lead to necrosis. And then the necrotic tissue will be smaller than normals. It causes atrophy on the cells. And then the blood escapes to the liver parenchyma, okay, into the liver tissue. Parenchyma means the main tissue of organs. Okay, this escaped blood or blood extravasations, some of the blood will be ingested by macrophages, and then there is formations of hemosiderin pigments. Okay, so we will find many of the hemosiderin-laden macrophages or hemocydrophages in the case of chronic congestions in the liver. So if there is a chronic congestions, this dilated blood vessels will make certain pressures in the surrounding tissue, and also it makes the oxygen concentrations low because there are so much of carbon dioxide in the tissue. There will be hypoxia, and hypoxia will lead to degeneration and then necrosis. The necrosis will be centrilobular necrosis. Centrilobular necrosis means it's kind of necrosis that happen around the central vein of liver. Why it happened? Because the most susceptible cells that cannot hold the hypoxia conditions is cells around the central vein. So low oxygen conditions or hypoxia will make the liver cells around the central veins will die easily. Okay, so we call it centrilobular necrosis because those cells around the central vein of liver is really susceptible with the decreased concentrations of oxygen or hypoxia. And also this can also makes hemorrhages, and the liver will be dark red in color. And then some hepatocytes, in particular around the portal area, okay, they will also suffer hypoxia, but they are more tough than cells around the central vein. Those cells will make sort of degenerative process. Those cells in the edge of the lobuli, okay, or in the around the portal area, they will be degenerate. They will be broken, and in such process, they will retain the fat contents inside the hepatocytes. Okay, and then there will be what we call as fatty change, and it makes pale discolorations of the liver. Okay, pale discolorations of the liver. So congested part, dark red in colors, will be intermixed with fatty change, which is possess a pale colors. So combination between congestions and fatty change will produce nutmeg liver. Here, this is nutmeg liver. The reddish part here, okay, the reddish part here, it's mixed with the pale part, okay, mixed with the pale part. All right, so you can see here in the large vein here, this is not central vein. Central vein is much smaller vein. This is large vein, actually portal area. You can see here around the portal area, around the large vein, the colors of the cells is pale. However, there are also some reddish spot like this. So combinations of this reddish spot with yellowish spot like this are resemble or similar with the cut surface of a nutmeg like this here. This is nutmeg cut surface. This one here representing just like a congestions, and the pale part here reflecting the fatty change. Nutmeg liver. Okay, I think you're familiar with nutmeg, right? Used for spices. Okay, this is nutmeg liver in the more closer view. Okay, here it is the pale part, and this is the congested part, the reddish area, the reddish spot here, just like cut surface of nutmeg. So if we look closely, there is centrilobular necrosis, and this centrilobular necrosis occurs around the central vein. This is the central vein, very small vein, and the necrosis and degenerations will occur around the central vein. This is what we call as centrilobular necrosis. Okay. Yes, this is the centrilobular necrosis in more close view. There are congestions here, like this, dilated sinusoids, and also necrosis of hepatocytes. Okay. And then the next is about spleen congestions. Spleen congestions related with vein thrombosis and portal hypertensions. So portal hypertensions makes portal hypertension means is a long-lasting or prolonged congestions in the portal area of liver, and it also related with congested spleen. So it means that the blood from the spleen cannot flow easily, okay? Because spleen and liver, they have a spatial connections through the blood vessels. Or it can be happen also due to vein thrombosis. It means that there is a blood clumps that block the blood flow inside the veins. And then spleen congestion related also with increased hydrostatic pressures in the veins of spleen. Oh yeah, actually this also can be happen due to heart failures, this spleen congestion, in particular right side heart failures. Grossly, the spleen will be enlarged, dark in colors, more firm, and has a capsular tension. Okay, it means that if you look at the normal spleen, there will be the 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 surface of a normal spleen is wrinkled. Okay, if there is capsular tensions, the surface will be smooth. Okay, and microscopically we will find a dilated sinusoid, dilated red pulps full of blood. And then if occurs in long term or prolonged congestions, there will be fibrosis, okay, in the capsules or trabecular parts or in the sinusoid walls. And there are also hemosiderin. It means there will be many hemosiderin laden macrophages or hemosiderophages. And pressures from the enlarged sinusoid and also enlarged blood vessels will also make a prolonged pressures to the white pulps, and the white pulps will be atrophied in the late stage of the event. So this is the microscopy of congested spleen here. This is the schematic pictures. Here, this is the fibrosis happen, enlarged sinusoid that filled with red blood cells, and this will make certain pressures to the white pulps, and white pulps will be degenerate and then atrophy. Okay. Here you can see this is the fibrosis around the blood vessels, okay, and the trabecula as well. Here, the fibrosis, more collagens, okay, can be found during fibrosis. And then next is about hemorrhages. Hemorrhages is blood escape to the extravascular area. It can be happen due to vascular damage. Vascular damage can be per axis. It means ruptured vascular walls. Or hemorrhages or damage in the blood vessels can be happen also per diapedesis. Per diapedesis means there is no ruptures, but the space between endothelial cells will be wider. Okay, the space will be enlarged, and it facilitates the movement of initiates the movement of red blood cells into the extracellular area. And the severity of hemorrhages is depend on the locations and also the volumes of blood that escape into the extracellular area, and also the rate of leakage. It also affects the severity of hemorrhages. And then the shape or forms of hemorrhages can be a pinpoint, we call it petechiae, or purpura if it's the diameter is less than 1 centimeters, or ecchymosis if the diameter is more than 1 centimeters, or it can be a linear hemorrhages or red line. Hemorrhages with the shape of red line, for examples, can be happen in the case of a inflammation in the colon and rectum, in the case of colitis and proctitis. And then there is also paintbrush hemorrhages, usually occurs in the serosal part of organs or in the uh, cavities in animals. Okay, cavities means coelomic cavities like peritoneums or thoracic cavity. Okay, and then this paintbrush can occur also on those serosa of the cavities in the body. It can be happen peritoneums, kidney capsules, pleura, diaphragma, and others. And also there is also hematoma. Hematoma means a lumps or uh, sac of blood clots under a covering layers. Okay, means hematoma. All right. Okay, and then there are also nasal hemorrhages. We call it epistaxis. And there is also intrathoracic hemorrhages. We call it hemothorax. Hemorrhages in the pericardial sac, we call it hemopericardiums, or hemorrhages intra-abdominal hemorrhages, we call it hemoperitoneums, and also bloody cough, we call it hemoptysis. Usually this is due to erosions in the respiratory tract. There is also bloody vomit, we call it hematoemesis. Sorry, melena here. Melena is a bloody feces. Sorry, I haven't translate this part here. I just passed the translation, sorry. And then there is hemorrhages in the joint. We call it hemarthrosis. And then bloody urine, we call it the hematuria. Okay, and then there is also metrorrhagia, means endometrial hemorrhages, and menorrhagia means hemorrhages in the lower genital tract, in particular in vagina. Okay, and then hemorrhages also can be happen in parallel with the inflammations. So if there is damage, there will be response of body response against those cellular damage by, for examples, there will be transports, there will be leukocytes appears, and then the movement of leukocytes actually regulated by a vasoactive mediators. All accumulation of this event, we call it inflammations. So during inflammations, the blood from hemorrhages can also mix with mucus. Okay, mix with mucus. For example, in the case of intestinal inflammation or enteritis, and even those blood in the hemorrhages during inflammations can also mix with necrotic cells. For example, in the case of parvoviral infections, parvovirus. And then there will be also hemorrhages during the uremic gastritis. Okay, uremic gastritis due to high contents of blood, urea, and nitrogen in the body. That's very harmful to the body, causing erosions and then hemorrhages as well. And then there is also hemorrhages due to infections, for examples, due to infection of nematodes, Syngenus trachea, that cause erosions, massive erosions in the respiratory tract, in particular in trachea, or hemorrhages due to inflammations because of viral infection, for example, ILT, infectious laryngotracheitis in the trachea of chickens. It causes really massive hemorrhages. Okay, this is the pinpoint hemorrhages or petechiae. This one is, yeah, the large one here is ecchymosis, and the small one is pinpoint hemorrhages or petechiae. This is petechiae in the kidney, okay, of the pig here. This is in the case of hog cholera. And then this is petechiae also in the urinary bladders. Yeah, here is ecchymosis, admixed with petechiae in the subcutis of rabbit. This one here, ecchymosis in the heart of pigs. This one here, yeah, you can see here pinpoint hemorrhages in the cases of inflammations in trachea and larynx. This is early cases of ILT. Hemorrhages in the endocardiums here. Okay, and also hemorrhages in the myocardiums. And this is hemorrhages in the lung. This is very harmful. For example, hemorrhages in the lung, because the blood clot will prevent gas exchange, and that causing asphyxia here. Okay. Yeah, this one is paintbrush hemorrhages outside stomach. Okay, in the serosal part of stomach. This one also paintbrush hemorrhages in the serosal part of stomach. This is what we call as red line form of hemorrhages. We call it as linear hemorrhages. It occurs in the rectums. And then this is a sac of blood clots. Okay, this is blood clots but covered with thin layers of tissue. We call this as hematoma. This occurs in the spleen of horse. And this one is hemorrhages in the small intestines. Okay, I think this is occurs in dogs here. If we open if we cut the intestines within the intestinal organs, within the intestinal lumens, we will see a lot of hemorrhages. Actually, this is also admixed with some mucus. This is a case of parvoviral enteritis in a puppy. This is also hemorrhages during inflammations. Okay, this is, I think, in chicken due to Clostridium infections, and if it's happened in long terms, it can also cause anemia, and because anemia there will be hypoxia. Hypoxia will cause cachexia. Cachexia means emaciations, very skinny conditions, and if it's severe, it will cause also dehydration that leads to death. Yeah, this is cardiac tamponade or hemopericardiums. Here, hemopericardiums, it means blood clot in the pericardial sac. And this one is brain hemorrhages here in the ventricles of brain. Okay, and this kind of hemorrhages, if it's occur in large volumes, it will make pressures into the surrounding tissue and will cause necrosis of the brain. If it occurs in long terms, it will make brain atrophy and also necrosis of the brain tissue. We call it malacia. And of course, if there is damage in the brain tissue, it will lead to decreased functions or dysfunctions of brain. For example, there will be degraded reflex or depressions of respiratory centers in medulla oblongata. It will be very harmful because it will lead to asphyxia and death. And this one is hemothorax, hemorrhages inside the thorax, inside the thoracic cavity. So causes of hemorrhages, yeah, it's very clear. There can be happen due to trauma, okay, or there is fragile vascular tissue. For example, fragile vascular tissue due to atherosclerosis. It means there are hardening or also rupture of the blood vessels due to atherosclerosis. This has happened because there is chronic inflammation in the wall of blood vessels that initiated by the accumulations of fatty tissue of fats just under the endothelial cells. Okay, make inflammations, chronic inflammation make fibrosis, and then it will break off, the inflammation will break off the integrity of blood vessel and causing hemorrhages. Or hemorrhages due to vitamin C deficiency. Vitamin C form the collagenous tissue in the blood vessels. Less of vitamin C makes the collagenous tissue. It means the blood vessel wall will be more fragile and easy to break off. And then toxins. There are chemical toxins, venom, bacterial toxins that can cause hemorrhages, or even a nematodes like Haemonchus contortus causing hemorrhages in the abomasum of a sheep or goat. And there is also clotting factor deficiency that can cause clotting factor deficiency that can cause hemorrhages due to, for example, hemophilia, okay, or thrombocytopenia. You know hemophilia, right? A tendency for hemorrhages because they have deficiency in some clotting factors. So, okay, the risk of hemorrhages can be local effect. Okay, it means they are maybe mild, but it will be harmful if it happens in the vital area like medulla oblongata of brain. It can be also systemic effect if it occurs in large, for example, in large blood vessels, rupture of large blood vessels, large volumes of blood escape, and then it makes a systemic anemia that can cause a severe hypoxia. Okay, and then one of the things that we have to remember that loss of large volumes of blood can cause shock due to decreased blood supply to the brain. Okay, this is very severe conditions. Severe hemorrhages make loss of large volume of blood. Okay, it makes the amounts of blood that reach the central nervous system in the particular brain will be lower than normals. It makes the brain cannot get enough oxygen. Then the brain functions will be stopped, and of course it will lead to respiratory arrest or cardiac arrest that will eventually leads to death. Severity of hemorrhages influenced by the locations and then also the volumes of blood that escape from the vascular area. And then severity of hemorrhages also can make a ischemia process. It means low supply of oxygen in the tissue, and then this ischemia process can cause infarcts. Okay, I will explain this later in the next slides. Okay, and then blood clots can cause a blood vessels obstructions. So death to hemorrhages can be happen if at least 1/3 of total blood volumes escape from the blood vessels. And also that can be happen due to some inhibitions or blockade or some disturbance in the heart pumping activities. For example, in the case of hemopericardiums, the blood clots will prevent a optimum pumping activity of the heart. And then lung hemorrhages can cause disturbance in gas exchange, and brain hemorrhages, if happens in the vital area, for example medulla oblongata, will make respiratory or even cardiac arrest. Okay. Then there is also what we call as thrombus. Actually, thrombus literally means a blood clumps. Okay, so these blood clumps actually can be categorized into three kinds of morphology. First is hemorrhagic blood clots. This is antemortem event. Postmortem blood clots. This is actually a postmortem changes, not a lesion, not a pathology. And then this is thrombus, and then thrombus. Okay, we will explain this later in the next slide. Hemorrhagic blood clots occurs due to rupture in the blood vessel wall. There is extravasations of blood, and then if the blood touch the rough surface in the tissue, the blood will be clotting due to activations of clotting factors. Okay, this is commonly happen after rupture of blood vessels. Okay, even in mild conditions. Postmortem blood clots means a blood clot formations after animal death. After animal death, the heart stops pumping. The blood will be retained inside the blood vessels, or we call it blood flow stasis, and then the autolysis process will activate the clotting factors, because autolysis process will make detachment of endothelial cells. It make the inner surface of the blood vessels will be rough, and this will activate the clotting factors, and then there will be blood clots. Okay. In postmortem blood clots, the surface is smooth, not rough, elastic. There is homogeneous appearance in the cut surface, and also there is no layers, and it can be red or yellow in colors. Red if there is RBC or erythrocyte aggregations. Yellow if the blood clot, the postmortem blood clot, largely composed of leukocytes and also a little bit plasma. This yellowish blood clots, we call it the chicken fat clot. It can be found in animals which died due to sepsis, leukemia, or high fever. So you can see chicken fat clot in the large number if there is increase on leukocytes content in the body. Okay. The locations of postmortem blood clot usually in the large blood vessels, okay, or inside the ventricles of heart. And then thrombus. Thrombus is clumps or plugs of a blood vessels. Usually this thrombus will be activated, will be formed if there is damage in the endothelial layers. Okay. This if it's singles, we call it thrombus. If it's multiple, we call it thrombi. Process of thrombus formations, thrombosis. Okay, we have to remember that terms. And then this thrombus occurs due to covering the damaged endothelial layers. Okay, and in these cases, the thrombus will be strongly attached to the damaged sites. Okay, strongly attached with the damaged sites, not like the postmortem clots. Okay, postmortem clots, they are easily detached, but this thrombus strongly attached to the wounded sites. Okay, they just like a glue. Okay, that attach well with the surface. Okay, can be found in all type of blood vessels, even in lymphatic vessels. And then the appearance will be hazy red, and if we cut, there will be multi-layer. We call it onion shape, and there will be red colors because there are aggregates of red blood cells, or a bit yellow if there is aggregates of white blood cells that trap here in fibrin network. So in thrombus, there will be formations of fibrin as a part of the activations on fibrinogens. Okay, so fibrinogen activated into fibrin. This fibrin will trap erythrocytes and white blood cells, and this fibrin is very firm, solid structures that will make plugs to cover the damaged area. The staging of thrombosis, it can be vasoconstrictions. First, vasoconstrictions, for example, there is damage of blood vessels, there will be vasoconstriction first as a response of body to decrease the diameters of the wound. And then the wounded or damaged sites will activate the thrombocytes because damaged sites will have a rough surface. This rough surface will activate the clotting factors, in particular clotting factors in thrombocytes, and these thrombocytes will lead to formations of cellular matrices like collagens, fibronectin, and proteoglycans. It all makes a fibrin network. And then thrombocytes aggregates will attach between each others, and thrombocyte degranulations will release many of vasoactive mediators or enzymes that permit the clotting factors to be activated and makes more fibrin. So if the fibrins already formed and makes a plugs, there will be also fibrinolysis. Why? It's a set of conditions to make that the fibrin plugs or thrombus not grow or expand more. Okay, so it make the plugs or fibrins fit with the damaged sites. So this is the process here. First is vasoconstrictions to decrease the diameters of wound sites, and then there will be attachment of thrombocytes in the wounded area, in the damaged area. These thrombocytes will release enzymes like thromboxans or even adenosine diphosphate for the energy. Okay, and then the fibrin will be attached more, and the thrombocyte will be attached more, and then they will make a network of fibrin after activation of clotting factors like thrombin and others. And then after the plug form, the fibrin will trap also leukocytes and also red blood cells. So to make this fibrin networks or thrombus not expand so much, there will be fibrinolysis. Okay. However, sometimes the fibrinolysis cannot happen because the process of damage occurs chronically. Right. Thrombus complications can be happen as ischemia. It means local anemia due to obstruction of blood vessels, makes hypoxia, and then ischemia will cause hypoxia. This hypoxia will cause a necrosis of cells. Necrosis due to ischemia, we call it infarct. Okay, infarct has a quite specialized structures. We call it coagulative necrosis. Okay, infarct composed of coagulative necrosis. Coagulative necrosis means that the cell morphology preserved. However, the nuclei are damaged. And then grossly, there are a triangle shape or X-shaped lesions, and blood vessel occlusions happens in the tip of the lesion. So if it's triangle shape or X shape, so in the tip of the lesions, actually that's the main obstructions of blood vessels occurs. So that blood vessels cause ischemia to the surrounding tissue. So examples of infarct can be happen in kidney or myocardial infarct due to coronary heart disease, or if infarct happens in the intestines with the activity of bacteria there, it can be result in gangrene, and also bacterial infections in intestinal arteries also can be happen due to results of arthritis, invagination, and torsion. So arthritis, invagination, torsions, all that process will make blockage on the blood flow. Okay, blockage of blood flow causing ischemia, ischemia causing necrosis or infarct. So if it happens in certain area like intestines, intestine has a lot of bacteria there, secondary infections may occur. So thrombus, they are obstruct the vascular lumens, and sometimes the thrombus can be restructurized to make a canalized thrombus, because you see, if thrombus occurs, the pressures from the blood flow will break off some of the thrombus and make a new channel. Okay, we call it that as canalized thrombus. then the thrombus, if it's happened, rough surface of thrombus initiates more fibrin formations. So there is what we call as productive thrombus. In particular, this happens if the cause of inflammations, the cause of endothelial damage occurs for a prolonged time. And then the thrombus can be break down into small fragments. Small fragments of thrombus, we call it as thromboemboli. This is quite harmful because those small thrombus or thromboemboli can be trapped in the small blood vessels and then causing ischemia and further infarct. Okay, there is also a blood flow stasis due to completely filled thrombus in the blood vessels. Okay, and sometimes this thrombus also can make a free parts look like a tail. We call it a tail thrombus. And there is also a thrombus in the small blood vessels, capillaries, that commonly found in the case of sepsis or systemic infections. That those thrombus refer to the condition we call as DIC, disseminated intravascular coagulation. It means that there are multiple formations of thrombus due to multiple damage in the blood vessels. Therefore, the thrombus will be disseminated, will be distributed in many parts. And usually this DIC will also make hemorrhages. Okay, because sometimes if the DIC is severe, it cannot cover all part of damaged endothelial cells, and some of the damaged area will make some of the erythrocytes escape and makes hemorrhages. Okay, this is thrombus around the blood vessels in the brain here. This is thrombus. This is the hemorrhages after thrombus happened. This is a infarct. Okay, this is the infarct here. This is acute infarct because still red, contain more of red blood cells here. This is the pulmonary thrombus. Okay, blocking the pulmonary artery here. And this is also thrombus here with rough surface inside a pulmonary artery in dogs. Okay, this is strongly attached with the blood vessels. You can see here the rough surface. This is the histopathology of thrombus inside the veins. I think this is in heart, I guess. Okay, this is the large thrombus here. Here, the layers of fibrin here. This is the pale part here. This is the layers of fibrins. And this is the trapped erythrocytes between the fibrins. And thrombus composed of red part is composed of erythrocytes and also some leukocytes here. The purple dots here representing leukocytes, and also the eosinophilic part here. This is actually a fibrin layers. Okay, this is a coronary heart disease causing myocardial infarct. This is the coronary artery. Coronary artery are blocked by the build-up of fatty tissue. Okay, fatty infiltration just under the endothelial cells. This fatty infiltration will make blockade in the blood flow. Okay, it causes infarct because if there is blockage here, the erythrocytes cannot flow in here, and then there will be no supply of nutrient and oxygen in this part here. So this part will will have a infarct. Okay, this is infarct in the kidney, just like I said, X shape. Okay, you can see here, this is the infarct in here. Here, the infarct. Okay, this is the tip of the infarct. Okay, so probably the cases, the thrombus, the obstructions of blood vessels occurs around here. Here, the triangle shape or the X shape. Okay, this is infarcted area. Here and here, you can see here, this is the tip of the infarct. So probably the occlusions of the blood vessels occurs in here. Okay. So just like I said, emboli. Emboli can be defined as circulating fragments of blood clumps or foreign objects. Okay, so it flows in the blood, and then it can cause clogging of blood vessels and then causing obstructions. Okay, embolus trapped in the small blood vessels and then causing clogging in the blood vessels. Okay, makes this part of tissue cannot have a sufficient supply on oxygens from the blood. Type of embolus, there are many types, many shapes. So emboli from thrombus, we call it thromboemboli, or emboli can occur due to bacterial accumulations. For example, in case of lung inflammation, pneumonia, or pyometra cases. And then the emboli can be also as tumor, because tumor spreading into distant sites, we call it metastasis. Or emboli can be parasites like heartworm parasites, parasites in dog, we call it the Digofilaria immitis, or Strongylus vulgaris, causing aneurysms, causing colic. And then also there will be embolism from amniotic fluids. Okay, so usually after coughing. Okay, after labor, the amniotic fluid can escape and cause embolisms. Or emboli can also originate from fat. For example, in the case of bone fractures, or in the case of pancreatitis, inflammation of pancreas. Inflammation of pancreas can release fat droplets into bloodstream. Okay, and these fat droplets not mix well with the waters, with the fluid in the blood vessels. It makes the fat can be trapped in the smaller blood vessels and causing ischemia and infarct. Or emboli due to gas formations. For example, decompression disease usually found in the divers. Divers, divers, after they dive in long depth, okay, they cannot go back to the surface as fast as possible, because if they do that, there will be changes in the blood pressures acutely. There will be drastic changes in the blood pressures and these drastic changes will cause formation of gas in the blood. It will be very harmful because these gas formations will make some bubbles, and those bubbles can trap in the blood vessels and then blocking the blood flow. Okay, that's what we call as gas emboli. And also sometimes gas emboli also happens in purpose. It means that, for example, to kill the animals, euthanasia of animals can be done by injecting air into blood vessels. So, but that euthanasia methods not apply more because it's not so animal welfare now. Okay, this one is fat embolisms in the lungs. Okay, so the fat can be stained with oil red O staining. So this red stains refers to fat. Okay, this happens actually after bone fractures, massive or extensive bone fractures. A lot of fat droplets will be released in the bloodstreams. Okay, this is tumor emboli. These tumors, this is a small clumps of tumors that trap in the blood vessels. Okay, I think these blood vessels also blood vessels of the lung. Here, tumor cells inside blood vessels. And then this one is blood vessels with fat droplet inside, okay, due to fractures. This in the blood vessels of the kidney in the glomeruli. Okay, this is also fat embolism in the glomeruli of kidney in the blood vessels of kidney. Here, this is the vacuoles here. And then this is the amniotic fluid embolus. Okay, here. Amniotic fluid embolus, we can recognize that because there is squames from fetus like this. Okay, squame from fetus like this. Okay, this is can be harmful also. This is the main cause of death after labor or after calving. This is clumps of bacteria inside blood vessels forming emboli. Here, usually this is due to systemic infections of bacteria, particularly in case of sepsis. Yeah, these bacterial embolisms also can be originated from inflammations in the valve of the heart. We call it as valvular endocarditis, and this part of endocarditis can detach and then flowing in the bloodstreams. Okay, and then some of the fragments maybe can be trapped in the small blood vessels. Okay, this one is embolism of bacteria causing necrosis in the kidney. So the embolisms are so much and it makes a diffusely or extended lesions. This is the heartworms, Diosfilaria immitis, causing thrombus, okay, and also embolisms inside the heart ventricles. In particular, this is the right side of ventricles here, thin ventricular wall here. Okay, this is the Machers Dirofilaria immitis. Okay, that's all. Thank you for today. See you again. If you have any further questions, please don't hesitate to ask me. Thank you for your attention. See you again.